Are you curious about breast augmentation? Here to answer some questions about breast implants is plastic surgeon Dr. Douglas Grace. This is Daily Web TV. Today I'm here at the Grace Clinic speaking with Dr. Douglas Grace. Dr. Grace, I know a lot of people talk about breast augmentation, but what is the difference between that and a breast lift?
So the difference is that a breast lift is really depends on the position of the nipple. So if your nipple is quite low and you've had elongation of the breast either from weight loss or from breastfeeding, you generally need to move that nipple, and that's a breast lift. You also then look at if you lift your breast tissue up into where you want it to be. If you're happy with the volume, all you need is a breast lift. If you're not happy with the volume of your breast, even with moving it, then you tend to need a breast augmentation.
Okay, so breast lift would be repositioning the nipple.
Moving the nipple around. We don't take the nipple off, we just move the tissue around the nipple, so you maintain your sensation and its functionality. But if the nipple is low and you need to bring that up. So if the breasts are sort of sagging, that's when you really require a breast lift. Okay. A breast augmentation is if you're just trying to increase your volume.
Okay, so breast augmentation, if I wanted to increase it, obviously we're going to be inserting an implant.
Yes.
What different types of implants are there? Is there a traditional standard one?
Yeah, so generally you break them down into there's saline implants and silicone implants. And then you have round implants and anatomically shaped implants.
Okay,
So what are the differences? So a saline implant is a implant that goes in and we fill it with normal saline. A cohesive gel or a silicone implant is solid silicone that goes in. It's like a gummy bear. So they're really the sort of newest type of implants. What's nice about the cohesive gel silicone implants is one, they feel very natural.
Okay, that was my question. Does one feel more natural than the other?
A lot of times it really depends on the amount of soft tissue that the patient has. Saline implants tend not to feel as natural as the silicone implants, and they also tend to have a little bit more rippling because of the viscosity of the fill. The saline is like water, so it's very liquid. The cohesive gel, the silicone, is like a gummy bear, so it's much more structurally stable, so that we're able to give a nicer round shape to the implant, or we're able to give a nice anatomic shape to the implant. So what I mean by that is that with the round implants, we can sort of accentuate the superior cleavage area of the breast, whereas with the anatomic implants, we're able to have a nice natural takeoff and then fullness down below, so it actually gives you a nice natural shape looking to the implant. So with the advances in the cohesive gel technology, you can have a very subtle round implant to a nice firm high profile round implant. So you're able to, with many different types of implants we have now, find out after discussing with the patient what exactly you're trying to achieve, and then we're able to really match the type of implant with what you're trying to achieve.
So you're going to help me with this? You're going to tell me what...
Yes, absolutely. It's a very difficult issue for most patients because there's a lot of decisions and choices, and they're not sure which one's best for them, and they're not sure how to make them. So really, your surgeon will help. First of all, we can show you a lot of the different types of implants, and you put them in bras and put them in your clothes and take them home if you need. And then that way you can see the difference between a round implant and an anatomic implant and how that looks different on your body, and you will have an idea within your mind of what you want to look like. And then this way we're able to sort of achieve that.
What are the common questions that you do get asked during a consultation?
Well, I think one of the common is, what is the downtime? So the downtime tends to be, you really have very little pain. Again, with a lot of the pain medications and pain control with freezing that we're able to use, pain tends not to be an issue, but we still ask people to take a week off of work. And the reason, again, is we want to really maintain your blood pressure not getting too high, because as you increase your activity and you go back to work, you increase your risk of bleeding. And bleeding can then cause inflammation around your implant. So really, people need to understand that you want to take it nice and easy. That then puts you in a nice sort of projectile for healing very nicely, and that's what makes you get a great result. It's not rushing back to work, it's taking the time to heal well and not increasing your blood pressure. Another common question is incision placement. 3 main incision placements are, one is in the axilla, so in the underarm, one is underneath the nipple, and one is in the inframammary fold. So depending on the size of the breast and the type of implant, that can help us decide where you want to place your implant, your incision.
Will it scar?
You always have a scar. It's just that generally we're able to really minimize your scars so that the incision around the areola heals very nicely. In the inframemory fold below the breast, if you have a nice natural crease, we place the implant incision in the crease and it heals very nicely, and people rarely ever see it.
If somebody's interested in booking a consultation because they have lots of questions for you, where can they find it?
The best way would be to either call our office or to visit us on the website and to schedule an appointment. On our website we have lots of information, there are patient handouts, before and after pictures, and we describe the differences between the round implants, anatomics, and have pictures.
Okay, so lots of information and pictures on your site.
Sure.
Well, thank you very much.
My pleasure.
For more information on Dr. Douglas Grace, visit his website. Connecting you to your local community, I'm Tracy Bizot, and this is Daily Web TV.